On this episode of CARPe Diem, Community in the Time of COVID, we bring you a world stuck inside. Safety is critical, but community saves us. Come together with guests Ramona Captain, Jason Matlow, Dr. Shantakarbati, and Dr. Batya Bhatia.
CARPe Diem, seizing the day for Canadians as we age.
Welcome to CARPe Diem. These are difficult times, but we, as always, wanted to keep bringing you uplifting episodes and stories. And keeping that in mind, our first guest is Ramona Captain from CARPe, and she's going to tell us what they are doing for the older Canadians across the country. Can you give us a sense of what's happening at CARPe through coronavirus pandemic? How are they helping their hundreds of thousands of members?
There is a wonderful website, www.carpe.ca. I go to it every morning to get updates on COVID-19. There are various links, excellent links to all the government websites, plus others. So it's a wonderful site for older Canadians because it gives you everything that is available out there for us seniors to apply for aid. There's also a wonderful line in BC, 211. And you can phone this number at any time and there will be somebody there in numerous languages. And you can speak to a person about getting groceries, getting medications, getting help of any kind that you might need.
I think one of the things that I've marveled at is the compassion that the communities have shown.
Certainly has, and we're so lucky here in the Lower Mainland that we do have so many different organizations who are out there helping. So we are blessed.
Thank you so much for taking the time to be with us, and I'm sure that we'll have a chance to talk with you again and get more perspectives from the CARPe community. So Ramona Captain, thank you so much for being with us, and stay safe.
Yes, be well.
Yeah. There's so much community to celebrate. Our next guest is our very own videographer, Dean Atwal. He's going to take us into his community and show us local efforts. Dean, how are you, my friend?
We're good. How are you coping?
We're doing great under the circumstances. I'm so excited to talk to you about what are you finding as you're out there in your community?
I'm finding that there's a lot of good news stories to tell. Being Joy Television, that's what we're trying to focus on. You know, there's a lot of challenges out there happening in this unprecedented time, but there's a lot of solutions and the communities coming together, specifically in the South Asian Sikh community, which I'm tied to. I found there's been quite a fair number of community organizers coming together, pulling together to make something happen.
Yeah, because of course your community is very, community driven. You're a philanthropic team of people. And how are they coping now with the physical distancing? Because I know the temples are the hubs of community for a lot of people, especially your older citizens, right?
So Sikhs are expected to give back to their community in any way that they can. It doesn't have to be financial. It can be in the form of volunteerism or preparing or helping those who may need it. And at this time, the need really, through the story that's coming up, was to help those who couldn't get access to groceries or food, and also for truck drivers who weren't able to get that nutrition that they need while they're coming into town.
Well, I want to not make any more delays. Let's get right through to this fabulous, uplifting story.
We are delivering the flour, the milk, lentils, sugar, or some kind of vegetable as well.
A cornerstone of the Sikh faith is called langar, and roughly translated, it means community kitchen. Now, during this pandemic, temples across Canada are trying to get creative in serving their communities. And this one here in Surrey is providing temple takeout delivery.
We are delivering the food, actually the grocery every day.
And this is to your community here in Surrey and surrounding areas?
Yes, Surrey, Richmond, Abbotsford. And also we set up the truck outside for the drive-through food from 8 a.m. to 10 p.m.
With the closure of many fast food dine-in restaurants, truck drivers that are coming into Surrey and into Vancouver are having a hard time getting a hot meal. The temple is also offering a delivery service to any truck driver anywhere in the Lower Mainland.
I think the truck driver is also in the front line. So they will phone us from the truck stop, from the any gas pump outside of the Surrey in Vancouver the area. So we will deliver the food.
We really appreciate the help and doing this, getting our food, which is all vegetarian plus made in good environment, and it'd be really helpful, and we really appreciate it.
Reporting on the helpers, the positive, community kindness. Dean Atwal in Surrey.
When we come back, we'll showcase the philanthropy of local fashion designer Jason Matlow.
Still ahead on CARPe Diem.
So for me, the goal has been to get it to fit as tightly as possible and as secure on all perimeters as possible.
CARPe Diem. Seizing the day for Canadians as we age.
I'm thrilled to welcome a personal friend of mine and famed Canadian designer, Jason Matlow. Now, most of us know Jason for his fabulous couture gowns and dresses, but today we want to talk about your social enterprise. So Jason, tell me what's going on in your fabulous atelier.
I was contacted by a client and really good friend of mine, Jessica Taylor, who had started an organization through Facebook called Mutual Aid Vancouver. And what that organization is doing is sending volunteer drivers into the Vancouver community to deliver essential things, medications, groceries, whatever, to the elderly and people who are immune compromised. And she'd asked me if there was anything I could do to create some masks, something for face protection for the drivers and the volunteers, so that they would be protected moving out into the community, and so that the people they were delivering these goods to would also be protected.
Now, where are you getting your materials from these days?
The problem I'm having now is I've been in a standstill for a week because I'm waiting for supplies to drop. I need bias tape and various things, so I've been ordering online, and just deliveries have been a little bit slow, unfortunately. But as soon as things line to early next week, I plan to rev back up and just produce as many of these as possible. The goal is to do another 25, so the drivers at Mutual Aid Vancouver are covered. Then we're going to just start to produce these and deliver them out to people in the community. I'm working with Jessica and a couple of other people through Mutual Aid Vancouver to decide how we best do that. Do we get these out to essential workers? Who do we deliver the remainder of these masks to? So we're just trying to organize and figure out how we're going to do that next leg of it once we get this first bunch off to the drivers.
So have you had requests for some glittery ones?
There's already anticipation that after the lockdown loosens up a little bit and people begin to integrate back into society a little bit, that we're going to still, for some period of time, need to offer some sort of face protection and coverage. That is when I'll move into the ones that are more glamorous and more fashion related. Right now, I'm really just trying to focus on making them as utilitarian and functional as possible, and really just tweaking the design. The fit has been really important. I've learned from talking to my physician more than anything else to get a tight fit around the face. So that's been the focus now. Once I get that initial prototype going and we're really happy with the fit, then I'll branch off into more fashion related fabrics and Swarovski crystals and glamming them up so people can have them to have something more glamorous, because I think it's going to be important for quite a while to have a face covering on.
What, can you show me what these fabrics are and what it looks like?
It looks, I can show you what it looks like. So, and I can put it on and show you how it fits and what I've done differently.
Yeah.
There's just the pleats in these to make it open up. So what it will fit like is, you tie this one quite high on top of your head. I've added a little dart under the chin so that it hugs it in nice and tight. Once you have it on, there's a piece of gardening or sort of floral wire in there. You get it in position and you can clamp this down to seal this nice and tight to your face. So for me, the goal has been to get it to fit as tightly as possible and as secure on all perimeters as possible so nothing can get underneath the mask. Of course, for our drivers, and I know not every civilian can do this, we're talking about a plastic face shield. We've been trying to create ones that emulate as close as possible to actual PPE. And what we did was we got safety goggles from Home Depot, and we cut this plastic protector, and we just used binder clips to clip it onto the eyewear. So you get a plastic shield that goes over as well.
Thank you so much, Jason. And I love the mask. And of course, it's like all your designs, it's practical, functional, but it is beautiful. So I want to thank you on behalf of everyone receiving one. And the day that you get to make them for non-first line responders, or if you will, let me know. I'll order one too.
Fantastic. Yours will probably be one of those ones that gets some Swarovski crystals on it right out of the gate, so you have something a little bit glamorous there.
We're going to take a short break. When we come back, we'll talk to cardiologist Dr. Shantakarbati from St. Paul's Hospital.
Still ahead on Carpe Diem.
The clap is for everyone, and this solidarity is something which I think is so beautiful, and that we should keep on clapping even after this is over.
Carpe Diem. Seizing the day for Canadians as we age.
Welcome back. Now we're going to be talking to Dr. Shantakarbati right from St. Paul's Hospital. Thank you, Dr. Shanta, for taking the time out of your extremely busy days. Now, how are you doing? How are your teams, and what's really happening at St. Paul's Hospital right now?
I won't lie if I say that it's not stressful at times, but what we have gained out of this is the happiness of being together, working as a team, facing new challenges, finding out new ways of dealing with new situations. And moreover, the connection with the healthcare team, the government. You know, sometimes we feel we're a little bit disconnected with the government. We feel fully connected with the public health officials. This is going to define us, and I'm very, very happy that we have found a way to help each other.
Tell me about the outpouring of love for your profession. You know, the 7 o'clock clap here, there's the 8 p.m. in Italy. What does that do to the spirits of you and your team?
Yeah, I must before that say it's for everyone. You know, it's not only the healthcare professionals, it's for all the frontline workers. It's for people who are in the markets, people who are keeping our communications up, people like you, the media, people, the firefighters, the police. The clap is for everyone. And I also clap not only for us, but for everyone else. And this solidarity is something which I think is so beautiful, and that we should keep on clapping even after this is over. This is what's more important, that there will be difficult times, but all of us are in it together.
Is this stressful time affecting your patients?
There's so many people in the society who don't have the luxury of having friends around them or family around them. And it's so much of a burden to be diseased or to have no work and things like that. The other part of this is not only a medical disease, it's also a very big social burden. So it's my appeal to all the viewers to look after others, look after everyone in whatever way you can, because this is a time to help each other, and this is how our society is going to be defined in the decades to come.
Dr. Shanta, may we tap in and chat with you on another occasion?
Sure, absolutely. It's a pleasure. It's a pleasure.
Yeah.
More than that.
When we come back, we'll talk to clinical psychologist Dr. Batya from New Jersey, who's going to tell us exactly how her community is coming together.
Still ahead on Carpe Diem.
My friends who are in the healthcare at this moment, we are seeing some of our patients dying. We are trying to save lives the best that we can.
Diem, seizing the day for Canadians as we age.
Welcome back. Our next guest, Dr. Bhatia from New Jersey. She's providing a lot of support to her community in her role as a clinical psychologist. How are you doing and how's your community doing?
Carmen, it is exploding in New Jersey right now. We are hoping that it would peak in another week or so. So we are pretty overwhelmed. We are very overwhelmed. And so are my friends who are in the healthcare at this moment. We are seeing some of our patients dying. We are trying to save lives the best that we can. We're supporting each other. My family is very supportive and full. We are, I would say psychologically, we are very robotic at this moment. We are going through the process in a very almost desensitized way because we are in the middle of the storm.
Dr. Batya, I've heard Governor Cuomo use the phrase New York tough. I think exemplifies that unity in community. Do you feel New York tough?
I think so. I have never given that kind of label to myself, but I think I'm tough. One thing that I know is I will prevail, and I firmly believe in mind over matter more at this time than I did in the past. Would we come out of this together? Yes, we will. That is what I keep saying to myself and anyone, and many people are reaching out to me. How do I deal with it? And I would say, you need to do this, this, this. And then I will repeat, you need to do this, this, this. So a lot of grounding of our emotion is very important.
Dr. Batya, you stay safe, and thank you so much for taking time, and a big giant hug to all your friends and family in New York.
Thank you to you too, Carmen. Thank you.
My next guest is our very own videographer, Keir Juners. As a musician, I wanted to talk to him about how are he and his friends doing. So nice to have you with us, Keir. How are you doing?
I'm doing pretty good, Carmen. This is, I think, week 4, maybe week 5 of working at home. It's all sort of blending together, you know?
You're a musician. Tell me about your community. How are they doing?
Right. Well, a lot of my friends in the music community, they rely on gigs, on concerts, on performances for income, right? As our industry had to tear down all of our events from 250 people to 50 people, that's when things started to get tough. We couldn't play gigs, and those of us that really relied on that performance income couldn't get it anymore, right? That's turned a lot of us to online streaming. Those of us that are fortunate enough to have the means, it feels really natural for us just to start doing our performances online. And there are still ways to support artists while watching their performances. Like the virtual tip jars are something that's happening right now as well. So people can still support their artists that way.
Keir, thank you so much for taking the time to join us. And I'm really looking forward to seeing your piece on your friends.
Yeah, thank you, Carmen. Thanks for having me on.
I play in a rock and roll band, and all of my gigs for the next couple of months have been effectively canceled because of the pandemic. And my musician friends are going through the same thing. So, what is a stuck-at-home musician supposed to do? A lot of us are turning to online performances. Some musicians are streaming their virtual concerts from empty world-class venues. And others, like myself and other local faces in my community, are streaming from their bedrooms.
We are all segregated away in our various places.
Where are we going? Will you meet me?
How have you found the music industry has changed for you, a performing musician?
I did 2 Facebook Lives last week, and then I did my first Instagram Live, so it's pushed me to do that right away. It's a great way of just inviting people in, especially if you're trying to say, look, listen to this new song on Spotify or whatever, you know, you've got this relatively captive audience while they're with you.
Thank y'all for tuning in. I'm gonna do one more song.
What is the role that we play as musicians during this pandemic?
Our role is to, as artists, is to show the light, you know, be the light in the situation. Our role is to encourage people, show solidarity and support.
Honey, you know. Because I'm a nurse by trade, historically. on our end.
Pursuing his career of becoming a nurse and a musician didn't come without its fair share of struggles.
And it's kind of segued into music therapy, which was a blessing for me. I do the live thing and I'm promoting my own music as well. But I've always been blessed to have this backup career as well.
I wanted you.
You can follow #CanadaPerforms on social media to see about a short-term relief fund for Canadian musicians. Or you could always just buy an album. For CARPe Diem, I'm Kier Junos.
And wasn't it encouraging to hear all these stories about community, what we're all doing to rally around each other in these times? I encourage you to participate and to go find something that moves you. And the telephone is a wonderful tool, so please get in touch with your friends, your family, and certainly if there's an older person in your life, now's the time to call. I want to thank our guests, Ramona, Jason, Dr. Shanta, and Dr. Bhatia. And let's not forget what our president, Moses Naimer, always says, the best way to keep going is to keep going. So carpe diem and seize your day. Even if we're inside, we can still do it.